Welcome to the Wellness Effect. Paramedics are essential first responders in any medical emergency. And to help us understand their roles better is Dr. Vernon Wessels, supervising medical practitioner for ER24. Thank you so much for being with us.
Thank you very much. Glad to be here.
So, what are paramedics' responsibilities in an emergency?
Well, practically from a baseline, we would expect them to provide the initial emergency care of that patient. So that would be the clinical support, stabilization of the patient, depending on what the emergency situation is. And then also the onward management of that patient while in transit to a facility where they will then hand over the patient's care to a higher level of medical support, depending on the patient's medical condition.
I like that you said they're first responders. Now, when they go to a scene, do paramedics look at patients who don't have medical aid differently?
No, not from a clinical perspective, because all patients deserve the same level of care. And from the current requirements within legislation, it's anyway from an ethical and legal perspective, one cannot look at patients differently from a clinical perspective. What is, however, different is we need to accommodate the patient's means of payment with regards to their onward care. So when it comes to selecting a facility, that does get taken into consideration, because it would be unreasonable to take a patient to a facility where he's going to then lie while they have to make arrangements with another facility to transfer the patient, which then unnecessarily delays the patient's care. So from that perspective, it's preferable if it's, for instance, an indigent patient, that we take him to the appropriate level of state facility that can look after him, and his care initiates much quicker than if he was taken to a private facility, where the private facility would obviously also do the stabilization treatment that's required, but the definitive care might not be possible in a private facility because of the costs involved. And because of that, they would then have to do a transfer. And all of that just adds into the delay in that patient's care, which is not to the patient's best interest. So from that perspective, that part, the paramedics do consider. There are some cases where we don't have a choice. We do take the patients to private facilities for stabilization. And the private facilities normally accommodate our staff, help with the stabilization, and then they would arrange for onward management. Very often the same crew would then assist in taking that patient to the next level of care, to state facility if it's required. But as far as on-scene treatment is concerned, everybody's treated the same.
It's quite comforting to know that everyone is treated the same, especially when you have a medical emergency. How can people be best prepared for a medical emergency, to have that information on hand so that we can tell the paramedics, okay, I've got this medical aid, it says I should go there?
Well, there's a lot of things. Number one is be prepared before the emergency hits you. In other words, if you have existing conditions, heart conditions, you're diabetic, anything like that, be sure that your family or those that would be in close contact with you are aware of those conditions, because you might not be in a position to actually relay that information when an emergency happens. Medical alerts and what they call, in case of emergency, information, ICE information, that's quite valuable. Just be aware that a lot of people like to keep that on their phones, and sometimes in emergencies, the phones are not accessible, because if you're in an accident, your phone very often gets damaged in an accident. So if that's the only means of relaying that information to other people, it might not be the best means. Necklaces and arm bracelets are probably the best, and next level option would be a card in your wallet, provided nobody steals your wallet on a scene. So those are ways of relaying things, critical information like allergies, medication that you might be using, and critical conditions like diabetes, cardiac conditions, pacemaker, all those type of issues that would be relevant for the responders that are coming to treat you.
That's good. Yeah, so having all that information on hand is essential, and maybe sharing it with family members and close relatives.
Yeah, it's always frustrating when one arrives on a scene, especially at a home, where somebody is collapsed and unconscious, and nobody knows what medication the person uses. They do not know where the medication is kept. It just delays the whole process of managing that person optimally. So if you have got chronic illnesses, make sure that people know what it is, what you're using, where it's kept, just so that it gets dealt with much easier and quicker.
Yeah, and quickly, yeah. And when should you call for an emergency vehicle?
Okay, so that is a quite important question. In most of the life-threatening conditions, the sooner that you get called, or we get called, the much better the potential outcome will be. And a condition, for instance, stroke, which many years ago would have been dealt with, irrespective the time frame from when the response was done, the outcome would have been poor. Nowadays, there's a lot of treatment that's available for stroke specifically, which, if it gets initiated early enough, can have a very good outcome, especially if it's a ischemic stroke. So it's very important for family to recognize that there's been an emergency in that person. He's not reacting the way that he should. He's got weakness, he's speaking funny, anything like that. And rather call early, that we can intervene early, get the patient, and if it is a stroke, that's one example of where intervention will make a big difference. The other one would be heart attacks, especially with men. Men tend to hide the symptoms, or they write the symptoms off as something else, indigestion or whatever, until they get to the point where they no longer can actually manage the problem. And very often that is then when we arrive and the patient's in cardiac arrest, where we could have managed the patient that was not yet in cardiac arrest much easier to deal with, and likely that we would prevent him from going into cardiac arrest. So there's a lot of conditions that the sooner one can get help, the better. There is unfortunately also the opposite, where people abuse ambulance services. And especially in the government sector, there's a lot of misuse of services where people have the impression that because it might potentially be free, that they can use it for anything, going for their repeat scripts that they have to get from the facility, minor flu symptoms, all those type of things. And what they're doing in that situation, besides getting a free trip, is they're accessing a service which has got limited resources. And there is very often a situation where that resource was actually required for somebody with more critical case, but that call happened to come in after this person's call, in which case that other person is being delayed proper treatment. So I think people need to be wary of using our ambulance inappropriately. For the medical aid patients, they need to be aware that medical aids will normally not cover those calls. So there's a very often unhappiness when the people get the bill and the medical aid then says, sorry, but it was an inappropriate use of ambulance. So they're not going to cover it within any rules. And you end up with an account that you did not plan for.
Yeah. So you mentioned around people abusing, paramedics and calling for unnecessary things, but where do you draw the line? How do you know, to what extent do you know this is silly? And to what extent do you know this is a life-threatening?
Okay, obviously the expectation would not be, if you perceive it to be an emergency, then that's fine. Make the call. If a contact center has a different view based on the information you're providing, then the contact center will advise you that this is likely to be a case which that would not be necessary for an ambulance to utilize. And in the private sector, we would then advise the person that there might be a risk that his medical aid is not going to cover the cost. So that will be provided to you. So if you're not sure, make the call. Somebody else will assist you with that. I think there are a lot of people who feel that irrespective of what their condition is, that they justify an ambulance. And I think those are the people that we're engaging with now, to try to say, just consider it from other patients' perspective, that the fact that you consider this to be your right to have an ambulance come for a non-emergency condition is negatively affecting other people. And those other people could be members of your family as well. So just bear that in mind. So I'll give you an example. For instance, we've had cases where a person has had an abscess on his finger. He has to go up for follow-up dressings. And he would go to a pharmacy and he would ask the pharmacist to phone the ambulance to take him to the hospital so that he can go for his follow-up. Now, those are real cases. Those are things that we actually see. Now, that is not an appropriate use of an ambulance. And the person obviously knows that, because there's no ways that he would ever be able to say that's an emergency. It's a follow-up procedure. So I think those are the cases which is what I would term abuse. The other cases might be what we would rather term inappropriate use. The person doesn't necessarily realize that he's inappropriately doing. And in those cases, as I said, rather make the call. The contact center will assist you with regard to identifying if this case. If you're not sure, you can ask the contact center to say, I'm not sure this, if I should be using an ambulance. I've got this condition. Will you send an ambulance or not? And then the contact center will be able to say, sir, no, unfortunately, we're backlogged at the moment. We feel that it would be best if you use a taxi or alternative transport. So there are ways of addressing those type of issues.
Yeah. I like that you mentioned that individuals calling need to be aware that if they call for an emergency vehicle, then the issue is not life-threatening. You're actually putting someone else at
Yes.
risk who's having a life-threatening
Yeah.
situation. Yeah.
And unfortunately, EMS doesn't work on constant calls. So if a service gets 1,000 calls a month, it doesn't mean that they're getting one call every 20 minutes or 15 minutes. Sometimes they get 50 of those calls within 10 minutes.
Sure.
So, and that is unfortunately very often the time periods when people make these unreasonable requests. And there is triage systems that we do use in the contact centers as well. And normally we will advise somebody that, yes, you want to use an ambulance, but your condition is what we would consider priority 3 or green case.
Okay.
So that is not a life-threatening situation. We've got 5 other cases that are life-threatening. They are going to get priority above you. So there is going to be some delay in getting your ambulance to you. And most patients, if they know that they don't have a life-threatening condition, would accept that.
And we're getting into this festive season where individuals might, attend to a party and drink
Yes.
and drive. What advice would you give to the public around that from an ER24 perspective?
Okay, I'm going to say something now, which I hope is not going to be taken wrong. Tongue in cheek. I always say paramedics fix stupid. So bottom line is, don't do things which is going to expose you to harm and going to unnecessarily put you in a situation where you're going to need you or people that is affected by your actions is going to require emergency care. So drinking and driving is a no-no. If you're going to drink, rather make arrangements that somebody else is going to take you home, sleep over, whatever would be the more appropriate way of preventing you from accidentally making a mistake. Unfortunately, the general rule is 3 drinks of any drink, alcoholic drink, is going to push you over the limit. So if you take those 3 drinks shortly after each other, you're likely to be in a situation where you're not going to be able to make a decision properly. And unfortunately, as you get more drunk, your acceptance of your state of inappropriate thinking just gets worse. So you're actually not able to recognize. So make those arrangements prior to having the party, that you already have that in place. You don't have to worry about it. And follow your friend's advice, because they can see when you're starting to act inappropriately. Right, the other condition that we very often find during the holiday periods, which unfortunately is also a preventable issue, is water-related incidents. And one of those that is always a sad situation is kids that end up drowning in pools that should have been protected access, or where the supervision is suboptimal, where the people that are supposed to be supervising the kids are having drinks and they're not in the optimal mode of actually watching over the children. It literally takes an eye blink for a child to fall into the water. Nobody notices it. And then when we get called, it's usually a quite late situation. And most of those children do not do well, even if we do manage to save their lives. So the critical issue is to ensure that the children have proper supervision with regards to when they're around pool or water bodies, and also ensuring that access to water bodies is limited, that children do not get access to pools when there's nobody who's going to actually supervise them while they're swimming. The same applies to rivers, dams, water reservoirs. Other issues that we want to emphasize is children that are traveling, because there's obviously going to be a lot of travel during the December holidays especially, and actually all holidays. And one of the challenges is that children that are involved in an accident basically become missiles during that accident. And besides injuring themselves, they also become a hazard for the other passengers within the vehicle. So a number of passengers can be injured purely because of a simple act that was not followed by restraining that child adequately in an appropriate child restraint in the vehicle. So if you do not have that, and your child is a toddler or a young child and cannot use normal safety belts, please ensure that you purchase an appropriate seat for that child so that he can be restrained. Children are precious. We never want to lose them. And it's always sad when we at an incident scene and we see an incident where people have been injured to the point where they are going to have permanent damage or death, and it all could have been prevented just by having made the proper preventative measures.
Who's the best person to call when you have an emergency?
Well, we obviously consider our own service to be quite a good service. That's 084124. That's the one that we would prefer you to utilize. But there's also the government services on 112. Those, if you phone 112, they will direct you to the most appropriate service within your area. And then the government's toll-free number for government services is 10177. That's an old Telkom number. But 112 is probably the most safest one. And if you can't remember our number, 084124, you can even use that 112 and request to have ER24 respond to you, and they will direct the call appropriately.
084124.
084124.
Love it. This has been really informative, and I also think it's almost a call to action. Thank you for this engaging and
It's my pleasure.
informative
Everybody out there,
discussion.
think and be safe.
Like that. Think and be safe. And thank you for watching. Till next time. BankMed, the medical scheme of choice for the financial services industry. The Wellness Effect is proudly brought to you by BankMed, yours in good health.